Two questions for the emerging contaminants. That's the PFCs and I'm not sure I'm going to get all the initials right, the PFBAs and isn't there a report coming out on this?
Mr. Chair, my name is John Stein. I'm Assistant Commissioner for Health Protection, and Representative Slawik, the reports that we do on contaminants of emerging concern are actually establishing health risk limits or health risk advisories. The contaminants you're talking about, perfluorinated compounds, there have been, we've already published those numbers, and we are doing some ongoing biomonitoring work in the community to see how the interventions have helped to lower the levels of PFCs in the population there. So you might be thinking of that report.
Okay.
This work is tied directly to developing the health risk information associated with contaminants that are not subject to what's called a maximum contaminant level under the EPA's Safe Drinking Water Act, or so they're contaminants that we find present in the state of Minnesota to which our population is exposed. And then we look at the available toxicological information and come up with health risk information associated with those contaminants that will be not really on the federal radar for quite some time because they're either not present in other states or people are not exposed to them in other states. So this work is really to characterize those contaminants that are relevant to our population for which the federal government will not be making determinations.
Representative Slawik.
And thank you, Mr. Chair, Mr. Stein. Just to clarify, we've talked about this a lot.
Yeah.
And we've talked a lot about it in Oakdale and in Woodbury and in our communities. So with, because the health risks have been established, is that remember there's PFCs and there's like 8 different ones. Are all of those clear, or will any of those be part of that? Have all those been set, the health risk limits for the potential contamination from 3M dumping into the landfills?
Mr. Stein.
Mr. Chair and Representative Slawik, we do have values established for 3 of the PFCs, PFBA, PFOA, and PFBS. Those are all perfluoro, and then you got to add a whole bunch of long syllable words after that. But they're 3 compounds that are a byproduct of 3M's manufacturing process that were disposed of in landfills and other disposal sites across Washington County during the 40s, 50s, 60s, and the 70s. And there are other PFCs that are found in the groundwater for which there are either no health studies yet available, or for which we don't believe people are being exposed at a high enough level. One of the things that did occur following the discovery of those compounds in the groundwater were there are a number of interventions carried out in the community. The city of Oakdale, as you know, has granular activated carbon treatment of their wells to lower the concentrations of PFCs in their drinking water. The city of Lake Elmo constructed a new water supply system to serve households that had previously been on private wells, and those residents are drinking water that is below the health risk levels. The same thing that was carried out similarly in Cottage Grove, Newport, Woodbury. Woodbury did not have any areas of high concern except around the Woodbury disposal site, an old 3M dumping site. So the good news from a health risk standpoint is the population was served with water that was treated or did not contain those contaminants. So the other study we're working on right now that I know was to look at the sample populations, 2 sample populations of people who volunteered for studies to look at levels in their blood of these compounds. We collected that data 2 years ago, and we're now in the process of collecting it again to see if their levels are declining, and that's the intention of that report, is to look at that information.